Hi, I'm Allison Zaromsky, and I'm an assistant professor in the Division of Behavioral Medicine and Clinical Psychology at Cincinnati Children's Hospital Medical Center. With my colleagues, Jeff Epstein and Heather Soselsky, in this manuscript, we explored the relationship between specific symptoms of attention deficit hyperactivity disorder, or ADHD, and functional impairment. The current diagnostic criteria for ADHD require the presence of both ADHD symptoms, which fall into the domains of inattention and/or hyperactivity and impulsivity, as well as impairment in at least one area of functioning. ADHD looks different in each child. Typically, the impairments are what are most distressing. Parents or teachers notice that the child is having a hard time making friends, or they're struggling to make progress academically. They have disruptive behavior in the classroom. Difficulties are getting in the way of participation in sports or extracurricular activities, or there are strained relationships at home with siblings or parents. Understanding the relationship between specific ADHD symptoms and impairments has the potential to inform our understanding of why some children with ADHD struggle in certain areas and some do not, and may inform intervention. We were excited to build on the work of others who had started to explore these relationships at the symptom domain level using teacher or parent ratings, and at the item level using teacher ratings. To explore the relationship between specific ADHD symptoms and impairments, we did a retrospective data analysis of parent and teacher ratings of symptoms and impairment from the Vanderbilt rating scales, using a national sample of over 8,000 children between the ages of 5 and 12. We knew that things like age, gender, internalizing and oppositional symptoms, having a learning disorder, having an autism or pervasive developmental disorder diagnosis, and medication status may contribute to functional impairment. So we took those variables into account. Overall, our findings showed a pattern in which specific ADHD symptoms are associated with specific areas of ADHD-related impairment, and this pattern converged across parent and teacher ratings. Our results indicated that in the area of academic functioning, the ADHD symptoms, makes careless mistakes and avoids tasks, were significantly associated with academic impairment across class subjects and across both parent and teacher ratings. Notably, after taking into account the variance accounted for by oppositional defiant symptoms, ADHD symptoms accounted for very little variance in impairment in the family and peer relationship domains and in the organized activity domain. The strongest predictor of impairment in classroom behavior was the ADHD symptom, talks too much. Having an increased understanding of the relationship between specific ADHD symptoms and functional impairments may be an important next step toward the implementation of targeted early intervention strategies. For example, we learned that there is a strong relationship between the ADHD symptom, avoids tasks, and functioning in the academic domain. Additionally, we know that there are classroom-based strategies that can be implemented to decrease task avoidance. Specifically, small group instruction has been shown to be associated with increases in on-task behavior in students with ADHD. Additionally, we know that the daily report card is an evidence-based intervention that can be used to target work completion and to decrease task avoidance. What this means is that as soon as a teacher notices that a student is struggling with task avoidance, that may be the opportune time for the teacher to consider implementing these strategies to decrease the likelihood that this will become more of a problem in the long term. We encourage you to continue to read the rest of our findings and to help us think through the implications of these findings on our understanding of ADHD, as well as the implications of these findings on our understanding of how to best manage ADHD. Thank you.